Thank you for staying with us on Health Matters on Channels Television. It's time for Health Matters. I am Yomi Otaigbe. As we all know, the COVID-19 situation is still very much on our hands, especially with the Delta variant in the mix. The number of cases in Nigeria is gradually increasing, and that's why we all need to take extra care and observe the safety protocols. In the last 24 hours, the Nigeria Center for Disease Control, NCDC, reports that 565 new COVID-19 cases have been confirmed, with 3 deaths in 16 states plus the FCT, bringing the total number of confirmed cases to 142, out of which over 165,000 patients have been discharged. There are currently 9,542 active cases and a total of 2,181 deaths. While tackling COVID-19 is one of the priorities of the Nigerian government, at the moment, a situation that could adversely affect the fight against COVID-19 and indeed the containment of the multiple concurrent disease outbreak being experienced in the country, such as cholera and Lassa fever, is the nationwide indefinite strike by the Nigerian Association of Resident Doctors. Resident doctors are those doctors who are undergoing postgraduate training to become specialists in different areas of medicine after graduation from medical school. Now, currently, they form the bulk of doctors in most secondary and tertiary hospitals. I think there are about 16,000 of them. They have been on strike since Monday, 2nd of August, over a number of issues, which cut across salary, welfare, working condition, and the residency training itself. The federal government said it has done its best so far in addressing some of the issues. The Minister of Labour and Employment, Dr. Chris Ngige, has asked the doctors to return to their duty posts by Monday, 9th of August, or the no work, no pay rule will come into force, and perhaps the doctors could be replaced by new staff. How can these issues be sorted out in the interest of both parties, and in particular in the interest of Nigerians seeking health services in public hospitals? To share insights into these issues and the possible way forward is a public health and health sector reform advocate who is also a former chairman advocacy of the Nigerian Medical Association, Dr. Henry Ewunono. Dr. Ewunono is a medical doctor in the field of pathology. He joins us from our Abuja studio. Thank you so much, Doctor, for being with us today.
It's my pleasure. Thank you for having me.
You'll agree with me that the country's health sector is going through another cycle of crisis. And as far as I can remember over the years, resident doctors have always had a bone or two to pick with the government over different issues, most of the time revolving around salary, working conditions, disagreements over certain policies, and so on. So why does it seem that successive government hasn't been able to decisively address the issues? Or is it a question of insatiable demands on the part of the resident doctors?
Thank you so much, and thank you, Channels TV, for your heightened attention since all this crisis began. You nailed it. Successive governments, same problems, and it is recurring. It emphasizes one thing: the approach and our problem-solving abilities. It means that we have not tackled the issue from the foundation. That's what it means. And the English people said, you cannot continue to do the same thing over and over again and expect different results. I have a document here, the National Health Act 2014. Part 5 of this National Health Act, sections 41 to 46, deals on human resource issues in the health sector. It places at the doorstep of the minister on his table Minister of Health, acting in concert with the National Council on Health, the state commissioners of health, to come together to fashion out, to look at, examine, develop, manage human resources within Nigeria's health sector. Strike by resident doctors is just a symptom of the issues bedeviling the sector. How I wish that we are discussing health sector system challenges in Nigeria, because that is the approach. Whatever we are seeing today, doctors in some states being owed up to 15, 20 months, agreements reached, not implemented, hazard allowance being less than 5,000 naira. These are human resource issues. So since 2014 that this law came into being, how has it been implemented? How many people at the federal, how many officials at the federal or state have taken this particular piece of legislation, looked at the prescriptions, the provisions, especially in that area of Part 5, to say, what can we do to ensure there are no strikes in the system? Why wouldn't there be strike in the system day after day? You keep on seeing that the malady is getting worse. We are being told that Nigeria is resource constrained, that the fiscal space is constricting. The oil is oil glut. We are facing oil glut. Yet, we now see their expansion of areas where the little expenditure, revenue available, gets expended. For instance, a few minutes ago, I saw on your news that Ekiti State government has signed a law creating new local council development areas. In these new areas, there will be a chairman, the vice chairman, supervisory councillors, councillors that may be elected, and several other bureaucratic positions that will need to be resourced. Yet, Ekiti State government is owing her doctors up to 4 or 6 months' salaries. So when you now tell the doctors to come back to work, and they are seeing their leaders doing that, that shows that the funds available are not properly being expended, or their attention is not on health. Health is not being prioritized. How do you want them to listen? So we need to be more holistic in the approach. We need to do all the analysis, the proper diagnostics of what is wrong with our health system. Strikes is just a symptom of one of the symptoms of the malady. And it is better. We doctors know that when you are treating symptoms, except, yes, symptomatic treatment to relieve the patient in some situations, but the best approach is to find out the cause. When you find out the cause, you'll be able to handle it. But I will help further. To finding out the cause, think of this scenario where children in a family always complain, we are not eating enough, we are hungry. They take it to their father, that their mother is not giving them enough food. That's why they are hungry. The mother says, I am trying my best. Price of gas has increased. Price of foodstuff in the market, they have increased. I cannot kill myself to become food. That's why you are not having enough. The father said, my revenue is dwindling. I cannot provide more. So who is to be blamed? Now it means coming back to the table and not just ordering doctors from one high pedestal, go back to work. No, that's not the way to do. We as doctors, we also love our country. We know that Nigeria has revenue issues. That is, of course, that's why the country is borrowing from everywhere. We realize that. But we want a holistic approach. And when you tell us Nigeria revenue is dwindling, we want you to demonstrate it. We don't want you to tell the citizens to tighten up their belts, to go on 101 or 001 while you are seeing the government officials are demonstrating affluence, flamboyance on daily basis. We hear in certain tiers of government and certain arms of government, the pays are gargantuan. And you tell certain people understand, there's a problem. Again, the Minister of Labour said a few weeks ago, the resident doctors were praising him that he's so good. If every other government official, will be like him, Nigeria will be a better place. That is right. But the minister knows that he doesn't stop, the buck doesn't stop only on his table. What of Minister of Health? What of Minister of Finance? What of the Accountant General's office? Are these also working like the Minister of Labour?
Permit me to come in here. So the question I asked at the beginning, it was like it's two-pronged. The first has to do with the government. So why is it that, successive governments haven't been able to address these issues? And I think, you've gone in that way. But the second part of it is, why does it seem as if, the demands of the resident doctors looks like something that is insatiable? How it looks like it's unending.
Well, yeah, yesterday I successfully made an intervention during the Sunrise program. And I said, what I've observed over the years is that it appears government officials that come to negotiation table, they don't do due diligence as per what government can afford before entering their signatures on those memoranda of agreement. How do I mean? When few weeks later, few days later, few months later, it now appears as if government cannot fulfill its part of the bargain. You come to the question of, is government capable of fulfilling that which it has entered into in the agreements? Again, my observation has been that after those negotiations, people pat themselves on their backs, people exchange handshake, if not for the COVID, everybody goes to sleep. Meanwhile, those agreements should have been timelined. They should have a timeline. And there should be an joint implementation committee of the affected MDAs together with agitators. And they should monitor it. Papers, because in Nigeria we love papers. So carry from this Ministry of Health, when they request for information from the health facility, the tertiary hospitals or so, it comes in good time. From there, it moves to the office of which office? Is it Accountant General, Minister of Finance, request for release of funds, cash backing, whatever. We have not seen this. After negotiations, people go to sleep. So that's what I have observed over time. Most importantly, the bedrock is lack of prioritization of health. This country has not prioritized health. The political system has not prioritized health. Health is not an issue during electioneering campaigns. No government has been voted out because doctors or the other health workers went on strike during this regime. I am yet to see where either the ruling party or at the level of at the federal or state level of the state, summon the minister or the commissioner in the state. Why are our hospitals closed? Is health not that important? We are told that, we need other sectors too, need attention. We need to build roads, we need to build bridges, we need to build railway. Between March and let's say September last year, where did those roads and railway and bridges take Nigerians to?
Doctor,
even those that have private jets, were they using them?
Doctor, we need to go on a break now. When we come back, we're going to quickly look at, how residency programs, are conducted in other countries and what other options the doctors could have employed in place of strike, because indeed Nigerians have died in the past and very possibly Nigerians would die during this strike owing to the strike action. We'll be back in a moment. Welcome back. The program is Health Matters on Channels Television, and we've been discussing the resident doctor strike that is currently ongoing nationwide. And if you have your question or you have a comment, you can join us in this discussion on 0808 054 2233. You see the number on your screen. Doctor, before we went on that break, I was asking the question, how does residency work in other countries, for instance, in the UK or in the US? The minister was saying that, we spend so much on our residency program, and at the end of the day, most of these doctors would leave the shores of the country to go and work, somewhere else outside of where they were really trained, and we spend so much money on it. How does it work in other places?
Thank you once again. Every country determines what works for itself. I mean, for the nation. There's no uniform standard. So I don't think there's a WHO document on medical residency training. Given this and acknowledging these peculiarities, that was why Nigeria in the year 2017 enacted the law called Medical Residency Act 2017, which specifies, the process, the management, and everything concerning residency training. One thing we will note is that abroad, let's say the UK and the US, most of those high-level universities and hospitals are privately owned. Nigeria has not gotten up to that extent. How it functions is that there is a basal level entry. For example, a Nigerian going to UK, you will write the qualifying exams that will make one eligible to practice in the UK. Then you start searching. It's so organized. There will be organizations you apply to you subscribe, that will help you look for spaces. And the NHS, through those hospitals, pay the residents. In some places, there's a junior program, senior program, until that person qualifies, obtains the fellowship, and exits the training.
Okay, Doctor, let's allow Ibrahim to join in this conversation. Ibrahim is joining us from Kaduna. Hello, Ibrahim.
Thank you for having me.
Ibrahim, you need to kill the audio on your TV set. It's howling back.
Okay, can you hear me now?
Yes, please go ahead briefly.
Yeah, thank you, Dr. Henry. Yeah, and thank you, the anchor of the program. The issue in Nigeria is actually a very terrifying one. You are talking about medical doctors who are actually, putting their life online. They are, frontliner when it comes to health issues, talking about, COVID, talking about all sorts of disease that we have around. And the minister for, labor can come out. It's only in Nigeria this thing can happen where you will be threatening, striking doctors that actually, giving their best to patients and trying to see how, they help. Do you know how many doctors have left Nigeria because of this treatment? And you come out telling them, forcing them, threatening them that they should return to work while you are there, not doing what you're supposed to do. Government will agree on something today. Within 24 hours, what they have agreed on will change. What type of situation have you found out?
Okay, Ibrahim. Okay, thank you so much for your comment. We appreciate it. Dr. Ewunono, so the federal government is saying, for now, no more discussions. The doctors say they will be there, waiting for any kind of conciliatory meeting. And, of course, the Nigerians would have to suffer during this period. Could there have been any way or any other way that the resident doctors could have gone about this without a strike?
I'll make 2 interventions here. One, back to this piece of legislation. Section 45 of the National Health Act envisages that there will be a period of industrial dispute in the health sector. And subsection 3 of Section 45 says, where the disruption of health services has occurred in any sector of the national health system, the minister shall apply all reasonable measures to ensure a return to normalcy of any such disruption within 14 days of the occurrence thereof. What this ministers to me is that if the minister cannot solve this within 14 days of this strike, perhaps the president should look for somebody else who can do the job. It is very unfortunate, rather than seeking solutions, to start issuing threats. This document has told us that there will be a trying period of strike. And government should use its resources to do that. The second one is about what we can do is for the Nigerian people. Because you say where elephants are fighting, the grass suffer. The grass suffering now is a Nigerian person who in 2023 will not ask the politicians what they will do for the health sector, how they will do it, how they will run this health sector that there will be no service disruption. So I take it to the people, Nigerian people. Do you people like your hospitals to be closed? I am not calling on you to start pouring on the streets, protest. No, that's not what I mean. Locate where your legislators are. I heard that most of them have traveled for summer holidays abroad.
Now that you're calling on Nigerians, Dr. Ewunono, Ayo is joining us in this conversation from Lagos. Ayo, briefly, quickly, what's your comment or contribution?
Yes. Hello.
Thank you for joining us. Go ahead, please.
Yes. Thank you, Dr. Ewunono. It's not a question of saying he should not call on Nigerians to go to the street. The truth of the matter is that the government and the resident doctors have their own faults. One, when I was listening to Dr. Ngige, it was quite clear that this ministry, Dr. Ngige, we did not follow up their agreement, like the doctor had said there. He did not follow it up. And the resident doctors as well, there should be an agent or body to follow up their demands. I mean, if they couldn't do this, it is unfortunate. Nigerians are suffering. How do you want us to understand a situation like this? The truth of the matter is that our legislators are earning so big, going to hospitals abroad, and the Nigerians are suffering. Where do we go from here?
Thank you, Ayo. We appreciate your contribution. Indeed, a lot of people are not happy, of course, about the situation. But in closing, Doctor, we have less than a minute to close. What would you say the government should give, and what grounds would you say the resident doctors should yield?
Resident doctors are available for discussion when you call them. Dr. Uyi, president of NARD, yesterday said he was yet to be invited for discussions. What NARD did after their meeting in Omahia was to resume a strike that was suspended. Maybe government thought the strike was entirely called off, cancelled. But NARD said, no, this was suspended and they are resuming because government has not kept its bargain. For the government should please prioritize health. And prioritizing health, the attention should start from the budgeting. Since 2001, when Nigeria hosted that meeting in the International Conference Center, where it was agreed that at least 15% of the national budget should be for health, the average in 2001 has been 4.7%. The highest was 6.7% in 2012. Since 2001, we are under average of 4.7%. This cannot lead anywhere. My analogy about the children that are complaining of hunger in the family, let there be more cake to share. Government has a means, the expertise.
This is a conversation that is going to
revenue.
continue, I'm sure, in the weeks to come. Thank you so much for your time. Dr. Henry Ebunonu is a health sector reform advocate who is also a pathologist. Thank you so much for your time. That's the program for this week. Thank you so much for your time and contributions. See you again next week. I am Yomi Otai.